I just completed an evaluation for a client who has left hemiparesis following a stroke. The client told me she read about constraint-induced movement therapy on an internet blog and asked if we were going to use this in therapy. I'm hearing this more and more, clients and their families telling me that they've searched the internet to find information about possible treatments. The problem is, these searches can yield information from sources that aren't always reliable. I tell my clients that it's my job to make sure the interventions I provide are grounded in current evidence to support best outcomes. I told this client that I would gather more information about constraint-induced movement therapy and discuss it with her at our next appointment. Now, let's see what I can find about constraint-induced movement therapy. These old textbooks that I have from my OT school days aren't really helpful to me. I need to look at peer-reviewed journal articles for the most up-to-date information. The problem is, I need to know how to execute a search that will produce the results I'm looking for in the most efficient way possible. I've been using some of the NBCOT Navigator Competency assessment tools. I wonder if there's something in the Navigator to help me with this literature search. Okay, let me just scan through the tools to see what's here. I think this PICO game could be just what I need. I remember from OT school that a PICO question helps you articulate what it is you need to know when completing a literature search. NBCOT's PICO tool looks like just what I need. It's a tool to assist me on how to complete a basic, evidence-based literature search. That's it. I was right. The PICO tool will show me how to create a PICO question and perform a focused literature search. It looks like there are 4 different modules. I'll try the first one just to get started. Oh, that's kind of fun. The tool uses cases that take place in outer space. This is a lot more enjoyable than reading about how to write a PICO question from a textbook. Okay, it's starting to come back to me now. I need to articulate the specific patient or population I have a question about, the intervention I want to look at, a comparison intervention, and the relevant outcome. Now, to put that all in the form of a question. Well, that wasn't so bad. I'm ready to put together a string of focused search terms and see what I can find in the literature. Oh, wow. Now I have to rank the evidence that I found in order of the best evidence available to answer the PICO question. Let's see. I know there are randomized control trials and case studies. Oh, shoot, I mixed some of them up. Let me try again. Okay, that looks good. I'm getting the hang of this. But I think I'll play through the other cases just to make sure I have a good grasp on it. I like how the modules get progressively more difficult. The on-screen assistant provides less information with each case. All right, now I know what I need to do for my actual literature search. My PICO question is, in adults with upper extremity hemiparesis following a stroke, how does constraint-induced movement therapy compare to bimanual training techniques to improve independence in activities of daily living? Now I'm ready to do my search. I'm going to log into ProQuest, another value-added benefit of my certification, and choose search terms based on my PICO question. This is great! I found a meta-analysis and a randomized control trial. I'll read these articles before I see my client. I wonder if my colleagues know about this PICO game. It turns out PICO has become a valuable tool for my colleagues as well. One colleague has used PICO to help a pediatric client with cerebral palsy whose insurance claim for a motorized wheelchair was denied. Another colleague used PICO to learn more about cognitive behavioral therapy as an alternative to medication for clients with chronic pain. My client is coming back soon for her follow-up appointment. By completing the PICO tool and putting the PICO process into practice, I've got some great information to share about constraint-induced therapy as it relates to her condition. I feel confident knowing that I can explain my intervention decisions and can articulate how I am using the current best evidence to maximize therapeutic outcomes.